Welcome to the 55th FSHP Annual, live here in Orlando, Florida. Today we're joined by Jeff Bush, Tamekia Bennett, and Elias Chahine. Nice to meet you, and thank you for joining us.
So thank you all for being here today. You know, you put on an amazing event. And just for the audience, if you can each go down and tell them a little bit about your role and how your experience at FSHP this year has been, starting with you, sir.
My name is Elias Chahine. I'm a professor of pharmacy practice at Palm Beach Atlantic University, and I'm a clinical pharmacy specialist at Palm Beach Atlantic University. I've been involved in FSHP for a long time, and I'm currently serving as a president-elect for the society.
Awesome.
I'm Tamekia Bennett. I am the operations director for FSHP. I've been with FSHP for 21 years. The annual meeting is like my family reunion.
Awesome.
I'm Jeff Bush. I am the Division Director of Clinical Pharmacy Services for the West Florida Division of HCA, which consists of 15 different hospitals. I'm the president of the society, and I have been on the board for 6 years and have enjoyed every minute of it.
And this is his first podcast, so we want to give him a nice warm welcome. So
I'm a rookie here.
So how important was it for you guys to have this annual this year? I know last year it was, virtual, and this year was in person. How important was it for you guys to move forward and having this annual this year? And what are you looking forward to? I mean, it's Friday. We still got Saturday and Sunday.
So the annual meeting it's more than just continuing education. It's, like I said, it's a family, it's a network of people that come to this meeting, of course, for the networking, for the continuing education. Since we had to go virtual last year, that was a big strain on the society. We've never done a virtual annual meeting. That was our very first. So we were looking forward to a live meeting, and then May, everything was going great. And then next thing you know, it was COVID 2.0, and we were faced with what's gonna happen now. Will we still go live? And 2 weeks ago, we were still pondering what was going to happen, and we made a decision, and we felt like we were doing the right thing for the society, and we knew that our members would come prepared. They would listen to our requests and follow protocol and just be safe for everyone around them. So it was a challenge, but we are here. And I mean, I'm emotional about the whole thing because it's been going extremely well.
Awesome to hear.
I think from a pharmacist standpoint, and I'll say the vendor standpoint, it was very important to get out and socialize. If you think about the year, we've been really closed in, whether we're working in the hospital or even in our personal life. Our whole life has been reduced to a virtual world, a 2x2 picture of somebody on a computer. So the first chance that we really had to open up the doors, it really was important, like Tamekia said, not just for CE, but to be able to socialize in an environment of professionals. I think it was extremely important.
So like Tamekia and Jeff said, so FSHP offer high quality education program for pharmacists, for consultant pharmacists, and for technicians, but that's not the only reason why our attendees come to the meeting. They come to network, to see each other. So particularly after the last virtual meeting, we felt that we can provide a good opportunity for our members to come and network with each other and see each other face to face. And we have more than 800 people who registered for this meeting.
And what does the future of pharmacy look like? And what are you all at FSHP, what are you doing proactively to be in front of that and to change the landscape of pharmacy? This is for anybody.
So pharmacy as a profession is moving from being product-centered to more of being patient-centered. So right now you see more and more clinical pharmacists that are rounding with doctors, that are providing direct patient care beyond the traditional role of distribution. So we're gonna likely to see more growth in the ambulatory care sector, which is the outpatient. So we're gonna see more and more doctors doctors working closely with pharmacists, with doctors diagnosing the patients and prescribing the initial treatment, and pharmacists assisting with optimizing that treatment, titrating the dose, monitor the patient for efficacy and safety, and then manage that drug therapy. For example, a patient show up with diabetes. The doctor will diagnose them with diabetes, will probably give them the initial treatment, and then the pharmacist will take it from there, titrate the dose, monitor the glucose, monitor the response to the medication, monitor the side effect, counsel about the importance of adherence. So we're going to see more and more pharmacists being placed in those clinics working alongside the doctors.
I think, part of your question was, what is FSHP doing proactively? We have a very active legal and regulatory council within the society that really are doing a lot of our legislation work. We're trying to work with American Society of Health System Pharmacists get a national provider status, which is extremely important for our profession. That being, once we're recognized as healthcare providers, we're able to bill for our services. So, we're working very closely with our senators, our congressmen, our House of Representatives to really let them understand what that bill is about. And it's not just about pharmacists, but it's giving our underserved population the ability to have more access to health care. And that's extremely important when you look at, right now, if you call a physician's office and try to schedule an appointment, you're 2, maybe 4 weeks out.
Yeah.
But with the ability for us to be recognized as healthcare providers, then that opens avenues where we usually have a pharmacy on every corner, especially in the state, that a patient could go and get some counseling or the needed, help that they're looking for. But without this, we have no system to be able to do that. Are we billing now? Yes, but at a very, very minor cost to the point where we can't sustain the programs right now that we have out there. So extremely important. We're also working with the Florida Pharmacy Association on moving some of our pharmacy technician bills and legislation as well. And one of the major things is requiring a national certification for our pharmacy technicians. And why is that important? Because it will give them the skill set, which they already have, but when you're nationally certified, it tells other people on the other side of, I would say, the avenue, the ability to say, yes, you are qualified to vaccinate or do some other things that really, we could have our technicians doing a lot more. So, those are just 2 examples of what we're trying to do proactively to move the profession not forward, but allow pharmacists to practice at the highest level, which we've been taught.
So FSHP is one of the many organizations in pharmacy. There's many other ones, but I think FSHP just has such a big impact in pharmacy. What do you say to those pharmacists that are not part of FSHP that you would like for them to be part of FSHP and maybe, give into the pack? And that's like the big part of FSHP. What is your message to those pharmacists that are not currently part of FSHP and you would like them to be?
I think, the big message I would probably say, it's not all about, the CE that we provide, but it's having one voice with one vision and one mission, and that is to move our profession forward. We have to have the ability to have, I would say, PAC donations because, money is important. It allows us to really get the support of our legislators, but more important, get involved in your own profession. Because if you're not, we're not going to be able to do, the things that we have, our vision. And your support not just, you know, money-wise, but your support going knocking on, you know, senators' doors or sending emails, you know, explaining bills that we have, explaining the reasons why we need to do what we, you know, have the ability to do. We're not asking for anything expansion of practice. We just want to be able to practice at you know, the level we've been taught. And it's important to have numbers.
Yeah.
Yeah, I would just say, just join us and try us and see what we're capable of doing, and then to see, to experience the FSHP experience, to come to our meeting, network with our members, and there is great strength with numbers. And then people who usually try FSHP and become members, they renew their membership and they become more engaged as time goes.
And that's what I was going to add, that from an operations side, looking at the number of licensed pharmacists that there are in the state, and you look at the major pharmacy associations, we don't even cover half of the pharmacists in the state. So I would just say, again, education is key. A lot of times they don't know what the society is all about. They think it's about paying a membership, but they don't understand the benefit behind it. So a lot of it is educating them on what FSHP can offer and what they can offer FSHP.
Do you think?
You know, it also gives you the ability to build relationships. And, you know, I have built relationships that will last, you know, a lifetime. We are a family. Yes, we are a society that they call us, but pharmacy is a small world. And really, when you get involved, you'll see that, and you will build, you know, lifelong friendships that really, you know, can help you.
Do you think it's been getting easier or harder throughout the years to get people to join? Let's just not even say FSHP, to just join an organization, to support something within your profession?
I think.
I was thinking, thinking out loud. So I am a member of an association of associations. So I've seen benchmark numbers of associations and trends. And I think it's consistent across the board that especially in the last couple of years with COVID and having to prioritize, is a lot of times the society gets pushed on the back burner because for some people, it's not at the top of their list, where you would think you would like your profession. You would think someone's profession would be at the top of their list, but trends are showing some consistency, but there's been a lot of loss as far as association members renewing. A lot of times it's fall off and pick up other members in their place.
I think the pandemic has hit home. When it comes to memberships. It's put people in a place where they have to make a decision. You know, our work demand has increased tremendously. So I would say personal time has decreased. So it's a choice, you know, do I spend that money but I don't have time, or do I just wait until things get better? And you know, we're seeing a little bit of a rise. Last year we did take a hit, but you know, we do our membership call campaigns on both pharmacists and pharmacy technicians, and try to figure out for the ones that say no, that they can't, the reason why, and then, you know, circle back when times are better. Don't just say, okay, you said no this year, and then forget about them, because that really shows them that we care. We really want you to be a part of this society, you know, a part of our family. And I understand when times are tough and we have to make tough decisions, but now we're getting better. So.
And you alluded to earlier that less than half of the practicing pharmacists are involved in organizations such as this one. So let's just say you're talking to somebody. What are the benefits of joining and being a member of FSHP? If you had to sell somebody on that, what do you want them to take away? What would you tell them?
So we do provide high-quality continuing education for regular pharmacists, for consultant pharmacists, and for technicians. We have also a day dedicated for pharmacy students. It's the ability to network with other pharmacists from outside your institution. So you would come to FSHP, meet other pharmacists who experience similar challenges, and you can dialogue with them and about ways to overcome these challenges so you can go back to your practice site and bring these ideas. Service is a profession, so you can engage in councils. So we have several councils and we have 2 clinical forums. So there's a lot of opportunity to be involved, and then you can work your way up to serve on the board of directors. So that's a leadership and service opportunity within the organization. Legislative advocacy, like I said earlier, and like my colleagues alluded to, there's a strength in numbers. So the more we come together as one voice, the more we're stronger, and then we can advocate to move the profession forward, and then to have more patients access pharmacy services. So these, I would say, are some of the key benefits of the organization, and we are growing. So in addition to our annual meeting, which is the largest annual meeting in the state, we are doing another smaller meeting that is going to be in fall 2022, and that meeting is going to focus on non-acute care pharmacy, so on ambulatory care pharmacy, again, to focus on the growth in that area of pharmacy practice. So now we have the annual meeting, we have the fall meeting, in addition to the regional society meetings that we have.
What I found is a lot of times when you don't really have a cause until the cause happens to you. So in your profession, sometimes you want change, and then you figure out, or you ask, how can I help be a part of the change? And then that's how some people actually have joined FSHP, because they heard about our Legal and Regulatory Affairs Council, or they heard about our Educational Affairs Council, so they want to be a part of that. And I think that's a lot of when people join an organization, like how can I benefit, or what can I do? And a lot of times it's great when we have those people that say, what can I do? And those are a lot of times the people that help to make the change. So I think it's just getting in the door and seeing what we have to offer.
Dr. Bush, when you sat in the seat as president, what did you want to accomplish before you pass on the torch? What was something that you said in your head, I want to accomplish this before I'm done?
Sure. 3 things, okay? The first was collaboration. I was a big proponent of one voice, one vision, one mission equals success. Then I talked about transparency within our society to our members. I think this year of all years, we had to be transparent. We did not have an annual meeting. We did not. Last year, we had a virtual meeting, and there was a huge difference. We didn't do a lot of the reports that we did at the House of Delegates yesterday. So transparency was huge. And then resiliency. We had to be resilient because with Bill had a great year, and looking down, our future was so bright, but we couldn't let the pandemic beat us. We had to be resilient. And so collaboration, yes, we're collaborating with Florida Pharmacy Association, we're collaborating with ASHP, we're collaborating with the Florida Hospital Association. Transparency, we implemented a town hall every quarter to our members, which the message there was financial stability, as well as our hard work and dedication of each of our councils, what we had accomplished on that quarter. And then resiliency, we accomplished our goals, and we fought back. And the biggest thing was that the work that our frontline pharmacists, all of our pharmacy technicians, and our pharmacy students, with the amount of vaccines that they put into patients, really elevated our profession to the world. They finally realized the point that we are a vital part of healthcare. So those are the 3 things that I really wanted to accomplish during my year.
And Tamekia, pose the same question to you. You've been with FSHP for a while. Maybe not go back to the first day that you came to FSHP, but when at some point you do decide to leave the position, retire, whatever it might be, what would you like to have been accomplished by yourself, and to leave what kind of impact would you like to leave on FSHP before leaving?
Well, one of the things that I'm most proud about is I'm not just a voice on the phone or a person on the other end of the email. I'm actually helping people. When I come to the meeting, it gives me pleasure to put a face with a name. So I'd like to say that when I am no longer here, that I left some sort of footprint of service to those who are members, because I feel very much a part of the profession, even though I'm not a pharmacist. But I feel like I can have those conversations with pharmacists. I've had a couple of Dr. Bennett emails, and I have to correct them in the email. And
hey,
say,
it's never too late to go back to school, you know?
Oh, that ship is sailed. But I'd like to
my
say
students refer to Tamekia as Dr. Bennett.
I know. But I've learned so much. It's not just a job. It's not just, I crawl out of bed in the morning, I got to do this. They can tell you I work around the clock because I want the profession to succeed. And I want to be a part of that, where when I'm gone, hopefully people will still say, well, Mika or Tamekia started this, or she was really good at implementing or getting things done. So.
Awesome. And yourself? Same question.
Same question. All right. So I'm going to focus during my year on diversity, equity, and inclusion. So I want people to belong to FSHP, to feel like FSHP is their professional home, no matter what their background, country of origin, gender, sexual orientation, area of pharmacy practice. I want everybody to belong to FSHP. I want them to feel like FSHP has their back and they can count on FSHP to move the profession forward. Another area that I want to focus on is to further engage faculty member, further engage pharmacy students and pharmacy residents in FSHP, because you have to remember that our pharmacy students and our pharmacy residents are going to be the next generation of leaders. So we should definitely invest in them so we can have good succession planning and longevity and engagement in the society. And for that, I want to establish 2 committees. One committee that will tackle issues related to diversity, equity, and inclusion, and another committee called Ad Hoc Research Committee, where we're going to involve faculty member, preceptors who are involved in research to be able to publish findings that show the role of pharmacists or the value of pharmacists in healthcare. So that's what I'm hoping to accomplish during this year.
Looking forward to it.
And just last question for the group. What to our audience, what are some things you want them to know about the profession of pharmacy and FSHP, and any thoughts, any last thoughts? FSHP. Any last thoughts to our audience?
Don't be afraid to get involved. No idea is a stupid idea. If you want change and you want to move the profession, we want to hear from you. We have no idea what you want, especially the brand new practitioners. You're entering a field that there is so much potential. Especially if we get national provider status, there is so much that we can expand to. Yeah. So don't be stagnant. We need young blood. We need young ideas, and we want you. And FSHP is a large society, but we're not. We're a family. And you know what? We listen to what our members have to say, and it's vital. Their voices lead to our success as well. So just get involved. Don't just get out of school. We're all tired when we were done with school. Yeah. But you know what? If you don't just keep going after the first year, you're not gonna get involved. And then you're gonna say, I missed that. I missed the ability to be a part of our profession moving forward.
Perfect. And I want to end it on this fun question. So I've asked this to everyone that we sat down with today, and we've asked this to every person we've had on the podcast for the past 2 years. So if we were to go back to undergrad, pharmacy school, or not pharmacy school, for Tamekia, for your undergrad, and we were to speak to your best friend, and we were to ask, who was Jeff, who was Tamekia, who was Elias, what would they say?
I'll answer that.
Kick it off.
Since I'm the elder in the crowd. When I started out, I wanted to be a physician. I went through, undergrad, got into medical school and decided that wasn't me.
Oh, wow.
That absolutely was not what I wanted to do.
Did you start medical school or no?
I didn't, no.
Oh, okay.
I declined being, which broke my parents' heart. So I floundered around. I didn't really know what I wanted to do. So I started at West Virginia University in my master's doing anatomy and physiology, okay? I get a call from my friends. They're like, hey, we're going to apply to pharmacy school. Why don't you join us? So my father being a policeman, my mother being a nurse, I called them and they're like, son, you need to do something. So I said to my friends, I'll apply and I'll apply to one school. And they're like, good, we're all applying to Mercer. So I'm like, okay, great. I applied to Mercer and got in and they didn't.
Oh my God, I knew that
And
was
I'm
coming.
like, okay, now I really have got myself into a jam because I have no idea about pharmacy. I've never even stepped foot in a pharmacy, but I'm afraid to call my parents and say, well, I got in, I'm not doing this either. So I went, and it was the best choice I ever made. I've been in long-term care. I've been in hospital. I've owned my own pharmacy. It has taught me so much, not just about pharmacy, but about life. And really, what pharmacy has to offer. The feeling of gratitude when you know that you helped somebody, just talking to them, or, when I was on the front line talking, learning, changing medicine, that you're there to make a difference. And I would not ever change anything again. I love my profession, and I would tell anyone, that is a profession that if you want to make a difference and you want to have a voice, that's what you need to do.
Well, I want to send a personal thank you to those two friends. And,
Exactly.
got you to where you
Oh
are.
my God, I let them have it.
Do you still talk to them this
I
day?
do.
All
I
right,
do.
all right. Well, they'll be listening. Maybe, you never know.
I've always been a talker from childhood, and so when
So
I got
podcast is the best platform for you.
Well, when I got to high school, someone said you should go to college to be a broadcast journalist,
I can
and I
see
did.
it. I can see it.
And 11 months before graduation, I decided I didn't want to do that anymore.
Nothing wrong with that.
There you go.
Everybody's like,
you
right,
go.
everybody's like, well, change your major. Absolutely not. I'm graduating in this class, and I'll just figure out what I want to do after. And after graduating, about 7 months later, I applied to a temp agency. And the first job was to FSHP. So I was a temp to permanent admin position to FSHP. And here I am 21 years later.
Wow.
That's amazing.
Yeah.
So when I was young, I wanted to be a teacher, and then my parents told me, like, you gotta have to pay the bills, so you're gonna go to medicine. You're gonna have to go to medicine, engineering, or law. So then I decided to go to pharmacy because that will combine my desire to be a teacher and at the same time being a healthcare professional. Because as pharmacists, we are educators. We educate the public about the use of medication. We counsel the patient about medications, and then we educate other healthcare professionals about how do we use medications. I'm glad I found pharmacy, and I'm hoping that my students and my residents and my colleagues will see how passionate I am and engaged in the profession of pharmacy.
Awesome. Thank you so much. Well, this was the finale of the FSHP podcast for this year's annual conference. So we want to thank you guys for taking the time out of your really busy day to join us today. And thank you so much for everyone that was tuning in and that will be tuning in. My name is Nima.
My name is Aaron.
And thank you guys for tuning in and joining us.
Thank you.
Thank you.